Welcome, everyone. I do have a chat box open if you'd like to ask any questions towards the end of the presentation. I do have everyone muted, but I would like to just say thank you all for attending this presentation on mold and mycotoxin illness. Just to give you a brief little introduction, my name is Dr. Jen, and I am a DNP. I've been in functional medicine for about 12 years. I was in a lot of acute care and ICU, ER level 1 trauma, but due to my own autoimmune issues, I decided to move into more of a functional medicine realm. And I have various certifications in functional medicine through A4M. I am certified through IFM, Institute of Functional Medicine. I did a Duke certification in integrative medicine as well. I've been a Georgetown professor, and I'm delighted to be a part of the Rose Wellness team. So thank you all for spending your evening with me, and I look forward to shedding some light on mycotoxin illness. Just to tell you a little bit about the presentation before we get started, it is really geared for laymen because most of you are likely joining us not as providers, but as potential patients or individuals that just have an interest in mold or mycotoxin. And as I mentioned, I will take a few questions at the end through the chat box. So once we reach the end of the presentation, I will stop recording and we will address a few questions. If there's additional questions, you can always contact Rose Wellness, and they can guide you appropriately. So thank you again for joining me. So just to give you a brief overview on what we're going to be covering during this presentation, we're going to give you an introduction to mycotoxin illness. We're going to cover some of the symptoms that one might experience if they are having mycotoxin illness. We're going to be talking about some diagnostics, different testing that we can offer both from a functional medicine perspective and also some standard blood work to look at immunity and toxins, et cetera. We're going to talk about some treatment options, how you would remediate if you have a mold issue in your home or in your work environment. Long-term support and recovery. As we know, this tends to be a very chronic issue, and it really requires some very astute environmental control. And then how you were to support prevention strategies in the event that you were exposed to mold or mycotoxins, or being sure that you're living and working in a safe environment that is not exposed to these types of toxins. So let's talk a little bit about what mold is. It's a fungi, and it can grow in many environments, indoors and outdoors. Obviously, with mold and mycotoxins, it usually requires a dark, moist environment. It can appear as a fuzzy, discolored patch. You can find it on walls, ceilings, leaky roofs. You can find it in basements. And you can find it even on environmental surfaces. The way it's reproduced is through spores. They're typically invisible to the naked eye, which means they can become airborne and move throughout our respiratory tract, causing issues. So what is a mycotoxin? They are toxic compounds that are produced by mold, and they can grow and multiply. They can contaminate the air, as we mentioned, and inoculate through respiratory inhalation. They can be present on our food, which can be problematic for individuals that are struggling with mycotoxin illness, because now they may be consuming food products that are contaminating them as well. And it can be on various surfaces in the environment, as we mentioned previously, such as drywall, roofing, basements, etc. Mycotoxins can pose some serious health risks to humans or animals when ingested, inhaled, or even contact dermatologically through the skin. Mycotoxin illness refers to a range of health problems that can occur when individuals are exposed to mold and mycotoxins. The symptoms can be quite varied, and people can present with a lot of constitutional symptoms, which may mimic a lot of other issues. And so it can be very difficult for practitioners, primarily conventional practitioners, that may not have this even on their radar, to even think that this might be a differential diagnosis. Individuals might struggle with things such as respiratory issues, shortness of breath. They might complain of exercise intolerance, exercise-induced asthma. They may have skin irritation, hives, rashes. They may struggle with headaches, cognitive issues where they're struggling with memory, brain fog, fatigue, and overall generalized discomfort. The problem is that mold can affect our immune systems and lead to serious health problems. How mold affects a person's immune system depends on your age, your sensitivity to mold, and how much exposure you've had. And so when we talk about sensitivity to mold, we're really looking at the study of epigenetics and your detoxification pathways. So if you're interested in learning more about genetics, there's some wonderful books out there. One is called Dirty Genes by Dr. Lynch, and it just talks about some of the different detox pathways that you can have measured in order to know whether you have good detox pathways or not so good detox pathways. So the symptoms can be varied. As I mentioned, different respiratory symptoms. We're going to get into that a little bit deeper. There can be neurologic symptoms, and there can be skin and eye involvement. Respiratory symptoms can include things such as a chronic cough. Patients may complain of things such as wheezing or shortness of breath, exercise intolerance, sinus congestion, postnasal drip, this sensation of a sore throat, or a runny or stuffy nose. Neurologic symptoms can also be random headaches, memory problems, brain fog, fatigue. You feel as though your cognitive acuity is struggling. You may have some difficulty concentrating. You may have feelings of dizziness or vertigo. You may also experience things such as fatigue or weakness. And skin problems can include things such as skin rashes, hives, itchiness, watery eyes, irritated eyes that just feel gritty and dry, and you may have some irritation of mucous membranes. General discomfort, we may see fatigue, this overall sensation of malaise or weakness. There may be nausea, muscle aches and pains, or myalgia. There may be some joint pain, unexplained weight loss, and digestive issues, which can run the gamut. Sensory and perceptual may include things such as headaches, again, memory problems, brain fog. Mood and emotional, you may find that you're experiencing more anxiety or panic attacks. You may experience low mood, depression, mood swings, or even short-tempered or irritable. So we know that symptoms can vary from patient to patient. Everyone is individualized. Everyone's genetic makeup is unique to themselves. And so the way that we handle toxic burden can be very different. It's not uncommon to find one family member in the same household that's contaminated to have issues, although many of the other ones may not. And that all comes down to your genetic predisposition and the way that you are able to detoxify. Also, we look at pre-existing conditions. So if someone already has a compromised immune system, if someone has mitochondrial issues, if someone has been struggling with chronic illness, they may not be able to process mycotoxin illness as well as someone who's otherwise young and healthy. Very important to consult with a healthcare practitioner for any new symptoms and to dig very deep, to cast the net very wide, look for a lot of different things, and typically we can sort of unfold what might be going on. We know that individuals that have pre-existing immune dysregulation are at higher risk for mold and mycotoxin illness. So if your immune system is already overactive, underactive, or just tends to react to things such as allergens, if you're someone who has histamine concerns, prone to hives and food allergies, if you have intestinal permeability issues and you tend to react to things more than others, then you would tend to have more of an issue with exposure to mycotoxins. We also know that mycotoxins can trigger or exacerbate chronic inflammatory diseases, autoimmune disorders, or even HIV progression. There's something called toxic mold syndrome, which includes various symptoms like cognitive impairment, emotional disturbance, and respiratory complaints. And again, mold is not very well understood. It's not something that's typically taught within conventional medicine. And so there tends to be a lack of understanding about the presenting symptoms or diagnostic workup, treatment, prevention strategies. There's something called mold-induced hypersensitivity and even something called CIRS, which we will speak about very briefly. But mold-induced hypersensitivity can trigger different reactions, primarily allergic responses. Patients can suddenly start having allergic asthma type symptoms where they've never really struggled with that in the past. They may struggle with a lot of rhinosinusitis. So suddenly they're just having congested sinuses, postnasal drip. They always feel swollen. They have a lot of frontal sinus pressure. It can also induce type 3 and 4 hypersensitivity reactions, such as hypersensitivity pneumonia. Mycotoxins in food can have long-term health effects, including immune deficiency. This is why it's very important to purchase organic food that is not laden with glyphosate. Wash your food, even if it is organic, because it can have presence of fungi and mold spores. These mycotoxins can have immunosuppressant or stimulatory effects. So we sometimes see immunodeficiency, but then we also sometimes see immune modulatory issues where someone is very hypersensitive to many things. And we know that these mycotoxins are linked to immune-related disorders. You're going to see some of my research articles that are listed on the bottom. Feel free to copy and paste those and read about more of the research. But we're going to dig a little bit deeper into mold exposure and increased asthma severity. So this slide is very busy, but it basically gives you a description of different types of molds which can be tested for, the component and how it's typically spread, the species of molds. Some come from mice, some come from humans, rat, the disease model that it typically presents with, the serum markers that you'd want to look for in these particular species of mycotoxins, and the outcomes. So in some, you'll see an increase in asthma severity. You will see pancreatitis. You will see different onsets of viral loads that may increase due to exposure of things like Aspergillus. Asthma is a heterogeneous disease characterized by airway inflammation and hyperreactivity. So these individuals tend to have a lot of inflammatory processes happening not only in their bronchioles, but also in their lungs. Mold exposure is one of the factors associated with asthma exacerbation and asthma development. And of course, if you have asthma, you should be seeing a pulmonologist, but it oftentimes can be classified into different phenotypes, can be classified from mild, moderate to severe, and typically this is diagnosed with something such as a pulmonary function test. They've done some meta-analysis in research studies on mold exposure and asthma presentation. And this particular study showed that dampness or mold exposure is linked to increased asthma development and exacerbation. Mold exposure can modulate asthma severity in two ways. It can sensitize, causing increased severity of allergic asthma, and it also can increase inflammatory mechanisms. Mycotoxins with asthma exacerbation, what we find is that it may act as an immunomodulator. It can worsen allergies, worsen asthma symptoms. Gliotoxin and patulin exposure increase the airway inflammation, eosinophil count, which can be detected on a complete blood count, and other specific IgE levels. Next, we're going to talk about mycotoxin exposure and its association with autoimmune disorders. In particular, we're going to talk about MS in this slide. It's characterized by neuroinflammation and axonal demyelination in the central nervous system and spinal cord. There's a correlation between fungal infections, specifically Candida and MS. Individuals that are exposed to mold have shown increased levels of neural protein autoantibodies, even without an MS diagnosis. Pretty interesting. There was also a cohort study on mold exposure, which showed that individuals exposed to water-damaged buildings and mold contaminated found positive IgG neuronal antibodies against various proteins. Increased autoantibodies can result from multiple factors, including environmental triggers and toxic chemical exposures. We also find in terms of autoimmunity that anti-mitochondrial antibody levels were elevated in patients with mold and moisture exposure. Mitochondria have such an important part in our cellular function. They're essentially the powerhouses of our cells. So if you picture a rechargeable battery that you use for anything in your home, our mitochondria are very important in terms of how charged is our battery. Hence, has a lot to do with energy expenditure, cognition, endurance, etc. Mold-derived mycotoxins may damage the mitochondria and trigger autoimmunity through the AMA antibodies. And this antibody is found in more than 90% of patients with primary biliary cirrhosis, which is a liver disease. Next, we're going to talk about rheumatoid arthritis with mycotoxin exposure, another autoimmune disease. There's limited data between the relationship of these two, but there was an experimental RA model which showed that mycotoxins, particularly ochratoxin A and DON, can increase the susceptibility and severity of RA in mice. And of course, a lot of mice and rat studies precede human studies and oftentimes have correlations. Mice that were exposed to these mycotoxins exhibited enhanced clinical scores of RA. So again, a correlation there between RA and MS with mycotoxin exposure. There's also been an association with an onset of inflammatory bowel disease, which is such a common presentation. Patients present with all sorts of GI concerns, whether it's reflux, bloating, indigestion, feeling as though they're very slow to digest, any sort of bowel urgency, any sort of bowel changes. So it's really important to keep this within your differential diagnosis. We also know that irritable bowel or inflammatory bowel disease is on the rise in both Western and developing countries. It is a multifactorial disorder involving genetic, immune, and environmental factors, including exposure to food contaminants. We know that our food is not the same as it was with our ancestors. Much of our food is genetically modified, and so our immune system looks at these proteins as very foreign. We know that our food is heavily laden with glyphosate, which is a pesticide and can cause intestinal permeability issues, otherwise known as leaky gut syndrome. When these types of things happen within the GI system, food proteins spill out prematurely. So the way I like to give an example to my patients is that your gut membrane becomes like pantyhose as opposed to a steel pipe. And the only way to really address leaky gut syndrome or intestinal permeability issues is to zoom out and figure out what the root cause is. Is there an underlying food sensitivity, food allergy? Is there underlying celiac disease? Are you being exposed to too many environmental toxins? And then we need to remove the offending issue and then put you on a gut healing protocol where I give the analogy of pouring concrete down your gut lining again until it's sealed. And this can be a long process, but it really requires that you remove the offending issue. So inflammagens and chronic inflammatory diseases. Inflammagens are what they sound like. They are inflammatory causing, and they are triggers for chronic inflammatory diseases. It's just a matter of identifying what that root cause is. And human case reports have suggested that mold and mycotoxins may act as inflammagens, contributing to progression of illness. We're now going to talk a little bit about mycotoxin exposure and HIV infection. There's been some research on this as well. 2 studies have suggested that mycotoxin exposure may worsen the HIV infection. In fact, they've studied aflatoxin B1, and the serum of HIV individuals were correlated with an increased HIV burden. And so could you also say, will it make other viruses worse? So we know that there are a lot of chronic viruses that the human race struggles with, such as Epstein-Barr virus or cytomegalovirus or herpes virus. If you ever had a cold sore, then you have the herpes virus. There's all sorts of viral issues that are within us. Now we have COVID-19 virus, and we know that when our immune system becomes troubled or becomes you become immunodeficient, then those viruses tend to replicate and cause more issues. Acrotoxin A and HIV target cell activation, they have found a positive correlation between OTA plasma levels and HIV target cell activation in a cohort study involving children exposed to HIV. And they have found elevated levels of the pro-inflammatory chemokine CXC were associated with OTA exposure in this study. They found a potential synergistic relationship between aflatoxin and HIV, which are causing immune modulation. And again, these are correlations, not causation at this point, but it's very interesting to see the work that has been done in the scientific literature. We're now going to move on and talk about mycotoxin exposure and related diseases. Mycotoxins are frequently occurring natural contaminants in the diet of humans and animals. So when we're eating animal products that may have been exposed to feedlots that may have had mold on them, then we are essentially eating what they eat. So if they're eating GMO corn that may have had mold on it, then we are now ingesting this as well, not to mention the food chain that we're exposed to as well. Crops are vulnerable to fungal contaminants, leading to co-contamination with multiple mycotoxins. Animals, which we just discussed, can be exposed to them as well. And then also home environments or workplace environments, especially people that are involved with organic dust exposure, can be exposed to mycotoxins. I regularly ask my patients if they've ever had a musty basement or a leaky roof, a leaky sink. Have they ever been exposed to buildings that perhaps have had leaks or have any sort of a musty smell? We're going to talk a little bit about the association with livestock. They have found several mycotoxins with high occurrence in foods and feeds consumed by humans and animals. Some of the toxic effects include cytotoxicity, liver and kidney damage, intestinal barrier disruption, which we just spoke about, which is leaky gut syndrome, immune modulation, and even adverse effects on fetal development. So what types of factors can affect mycotoxin production? Well, temperature. We know that warm, moist, dark environments will enhance the growth of mycotoxins in molds. Water activity can have a factor, pH, oxygen, substrate composition, and they can be released by molds when environmental conditions are suitable. Factors like we just discussed can all increase the exposure and the replication of mycotoxins in our environment, including airborne. So we're going to talk a little bit about diagnosis, right? Because a lot of these symptoms actually present in other ways, and they can lead a practitioner down one road. But this really should always be a part of your very detailed history gathering in terms of environment and toxic exposure. But it's always important to have this somewhat on your radar so that you're asking the right questions and doing the right diagnostic studies. So typically we start with gathering a very detailed history. When someone has symptoms that all of a sudden they're having coughing, postnasal drip, they may have asthmatic symptoms that they haven't had in the past. They're having headaches, they're having skin irritation, fatigue, brain fog, cognitive decline. They feel as though their mental acuity has been compromised. You want to keep this on your radar. Again, in functional medicine, when we gather a history, we go all the way back to even how healthy your mother was during the pregnancy with you. Were there any prenatal events? Were there vaccines? Were there illnesses that your mother experienced during the pregnancy? Were you a vaginal or a C-section birth? Were you breastfed or bottle fed? Did you have antibiotics within the first year of life? What kind of prescriptions were you on? We also know that a physical exam is very important in this, and an environmental history, as we mentioned previously. Skin rashes, when someone presents with eczema, psoriasis, they're starting to have chronic urticaria or hives. They get a lot of flushing from high histamine foods. You start to think really closely about the immune system and immune modulation. So patterns in the symptoms, again, are there multiple people in the same household or workplace that are experiencing similar issues? I've had patients who have said, you know, I work in this very toxic workplace, and many of us have felt very ill since we started working there. It's very important to look at an environmental assessment, looking at leaks and mustiness. And oftentimes I'll even ask them about a cabin. Did you have a lake house or a cabin growing up? And sometimes that will jog their memory and they'll say, oh, yes, I did. And it was moist and it was wet and it always smelled very musty. Or I had a cabin in the Adirondacks and it was very musty. And then, of course, we want to look at different history taking, but also there's some key quizzes that you can take. We can do various assessments, including physical exam, and then various specialized testing. I won't get into all of the details on specialized testing because this is geared towards a layman presentation. But from a functional medicine perspective, there are many, many, many labs that we can draw, many that you've probably never had assessed in your life. And there's also some functional medicine tests through Great Plains, or even Vibrant Wellness, which have a lot of very good mycotoxin assessment diagnostics. So, of course, if you think that perhaps you were exposed to this, you want to seek out a functional medicine practitioner who has experience with this, but also a functional medicine practitioner that has certifications and has experience. Because this tends to be more of a chronic issue. It tends to be more of a challenging issue to treat and to even discover. So do your homework. The IFM website is a great website because they will list practitioners in your area. There's also many practitioners that are participating in telemedicine and Zoom visits. So you don't necessarily have to see someone within your area, but you really want to do your homework and ask the right questions and even pre-interview to make sure that it's the right fit for you. And then, of course, you want to make sure that you have a very good partnership with your provider. Are they seeing you, hearing you, understanding you? Are they giving you the emotional support that you need? It's very important to make sure that it's a good fit. And then, of course, there should be ongoing monitoring. We know that oftentimes with mycotoxin or mold illness, there can be other associated issues such as Lyme disease or even chronic inflammatory response syndrome. There can be histamine issues. These patients can sometimes be on a very rigorous diet plan, etc. So you want to be sure that you have the support of a practitioner who's going to wrap their arms around you and support you for the journey. So getting back to questionnaires, there's some really great questionnaires, such as Dr. Jill Krista has a great questionnaire. There is all sorts of mold questionnaires. Dr. Richie Shoemaker was the grandfather of this, and he has a really great website with questionnaires, visual analog testing, all sorts of things that you can get more information and resources on. There's also some functional medicine tests. As I mentioned, a mycotoxin urine test. There's also a Vibrant Wellness mycotoxin panel. There is extensive blood work that can really hone in on the immune system and inflammatory markers. And you also want to look at other comorbid issues, as I mentioned before, such as Lyme, CIRS, even heavy metal toxicity, perhaps doing an oats test. There's all sorts of things, but it really depends on what the patient presents with and what their chief complaint is, what their history is sort of guiding you towards as far as, what direction you're going to take. How do we manage it? Well, there's all sorts of things. And again, it depends on exactly what we're treating, but it's important to give a holistic approach. Also give supplements that include binders. There are prescription binders such as cholestyramine, charcoal, all sorts of issues. There's different compounding pharmacies that are really valuable. Prescriptions that can help patients. You want to take it very slow and include other detox modalities such as castor oil packs and saunas and movement, sweating, making sure that you're eating a medicinal diet that can also bind some things as well. And then there's medication. So depending on what you find, some prescriptions are indicated in this regard. Whether it's a beg spray, whether it's EDTA, Sporanox, all sorts of different things, NAC and supplements. So you can get into that when you meet with the appropriate practitioner. We also want to focus on all of the things, right? Like nutrition and stress and sleep, and making sure that your body is the healthiest that it can be as it's trying to fight these mycotoxins and deal with the toxic burden. Meeting with a nutritionist can be quite helpful, especially if there's underlying intestinal permeability issues, if there's food allergies, if there's sensitivities, if there's histamine issues. You really want to be with someone who can really focus on what you can eat and not focus on what you can't eat, because it can be quite overwhelming. Life should be joyful. Food is such a social event and an environment that we want to make sure that people are feeling very well supported and feeling like that there is enjoyment with eating food. We're eating things that are pleasant, that they taste well, and that we're well satiated. So we're going to move, we've talked about, treatment, diagnostics, physical exams. We're now going to talk a little bit about, we have a diagnosis of mycotoxins and we're going through a treatment protocol. Treatment protocols can range from pretty conservative to very aggressive. So if you have a clinic near you that does any intravenous therapies, those can be helpful. Things like glutathione or ozone therapy, ultraviolet light. There's all sorts of things that can help. And of course, depending on what your blood work shows, is where your provider is going to find a customized plan for you. Do you need B12 injections? Do you need vitamin D injections? Do you need support with heavy metal detox in addition to struggling with mycotoxins? But once you get beyond that, we now need to look at the environment and make sure that we're not continuing to contaminate ourselves. So what do we do in this situation? Well, the first step is identifying where you're being exposed to this. So mold remediation, is it a leaky roof that perhaps you haven't seen? So looking for rings on your ceiling, making sure that your basement is nice and dry and you have high power dehumidifiers going, making sure that there's no sink leaking, and under your kitchen sink is a common place where how often do we look under our kitchen sink for leaks? It may be a very tiny leak, it may be a very small amount of moisture, but it may be producing mold and mycotoxins. So it's really important to figure out where the source is. If it's your work environment, that might be a little bit trickier, but there's ways to actually test your environment to know if you do have mold exposure. And of course, we want to look at ventilation. So I'm a big fan of Austin Air. I have one in my bedroom. I have one in my personal office. I have one in my kitchen. I have several in my practice. It's important to do air exchanges. You can Google that. There's a way, especially if you live in the Northeast. We have the same air for a very long time. You can Google NASA approved plants that you can find at your, Lowe's, Home Depot, your hardware store, that are pretty inexpensive, but they do an excellent job at cleansing the air, the indoor air. You also want to be cautious that the soil in your plants is not harboring any mold. So it's important to get professionals involved, both medical professionals, but also environmental professionals that really understand mold remediation, understand how to do it appropriately. The last thing you want is to call in someone to fix a ceiling and they simply leave all the moisture inside of the ceiling and just seal it up. And now it's dark and damp, and that could cause a whole host of issues. So make sure you're interviewing these professionals appropriately and that you understand how to appropriately treat mold. Sometimes you even have to get an ozone generator for your home or for a ceiling. And sometimes that requires humans and pets to leave the environment as well as plants. But it can do a very nice job at killing off the spores. Epivacuuming can be very helpful. You want to get to the smallest spores. Living in an environment where there's not a lot of carpets or moisture, making sure that your bathrooms have appropriate ventilation and fans. Again, drying things and dehumidifying is key. And then, of course, these individuals will need some ongoing medical care. They will need to have frequent checkups. They may have flares. Most individuals that you speak to with mycotoxin illness, they may go to a hotel room and immediately they have a very strong sensitivity to a mildew or a mold smell, and it may trigger some symptoms on and off. I'm treating some patients currently that they go into different environmental spaces and they realize that they're having an exposure, they have symptoms, and then they may have a little bit of a flare. You want to make sure that you're taking your medications as prescribed. You're staying on a very rigorous detox program. You are consistently, being sure that you're exercising and you're sweating and you're doing saunas and castor oil, Epsom salt baths, all the things to make sure that you're routinely focusing on detox, because that should be something that we're all concerned about, whether there's mycotoxin illness or not. We've talked about proper ventilation, Austin airflow, fans, exhaust pipes, HEPA filters. Humidity control is very important, especially for those of you that live in very hot, humid environments. And then leak prevention and appropriate leak treatment. You may want to periodically inspect your home for signs of water damage or mold. Basements, crawl spaces, bathrooms, under sinks, particularly the kitchen sink. Regularly cleaning. I'm a big fan of using holistic cleaners that also can be antibacterial, antifungal. So I'll often use things like hydrogen peroxide or colloidal silver, or I'll use things like tea tree or oil of oregano so that I'm not causing more toxins within myself, but I know that I'm cleaning appropriately. And then using mold resistant materials. So there's a lot of paints out there that are VOC free, but they also are mold resistant. There's drywall. So if you're building a home, consult with an environmental expert who can say, use this material and not that material. Carpeting is known to be an issue. So I would caution you with that. And then if you're interested in more information, if someone's asked if we can share the PowerPoint, we will share that through Rose Wellness. I would encourage you to send them an email and they can share the PowerPoint with you. If you're interested in different articles or different educational materials about mold and mycotoxin illness, there's some really good websites I'd like to share with you. One is toxicmoldproject.com. Another is Toxic Mold Guide, which is by Dr. Jill Carnahan, who is, she experienced mold illness herself, and she's extremely helpful. As I mentioned, the Krista Mold Questionnaire and Dr. Shoemaker. There's also some really good books on mold and mycotoxins, primarily Dr. Neil Nathan's book, Dr. Jill Krista's book, Break the Molds. There's some community resources such as immunolytics.com or Great Plains Laboratory has some information on mold illness. There's some webinars and podcasts. There's one called A Functional MD's Approach to Mold. That's by Dr. Jill Carnahan, and that's a podcast. Another one is Your Definitive Mold Cleanup Guide. Vibrant America also has some very good resources on mold. And then there's all sorts of reference studies. If you're interested in those, I could certainly share those with you. You can reach out to Rose Wellness. So I'm going to open it up to just a few questions and answers. What I'm going to ask you to do is, this is the contact for Rose Wellness. I'm going to ask you to just put your question in the chat box. I will repeat it and I will answer it. If I don't have the answer at my fingertips, I'd be happy to email you. But I just want to say thank you for joining me on this evening. I hope that this was very helpful for you. I would be very honored to be involved in your health journey in some way, shape, or form. If you're struggling with mycotoxin illness or any sort of immune dysfunction, I'd be happy to help you walk that journey. So thank you all for coming, and I hope to see you soon. So there's a question, is there a correlation between mycotoxins and anemia? That's kind of a difficult question to answer because it may be multifactorial. And what I mean by that is